The other piece to this whole hair thing is of the thyroid side. Like I got a thyroid issue, and I know that like I'm doing some work on it, and that's kind of preserved my hair. But I know for you, because you lost your thyroid, right? I mean,
Yeah.
it's I imagine that would have complicated your hair loss even more. So I would think.
Yeah, so that was the other health issue I had. Had surgery to remove my thyroid when
Mm,
I was in my the same around the same time, so mid 20s. I think it was
yeah,
25.
yeah,
Um, and yeah, that was the life-changing event that I mentioned before.
yeah, yeah. And was that something that just was it kind of tracking that way, or did it just was a big surprise all of a sudden, or
Um,
like did you
yeah,
know through blood work that it was your the thyroid was starting to fail, or
I
like
had a chest X-ray for
okay,
a different reason.
okay,
Um, when I was like 22, 23.
okay,
And then they said everything's good, but they found something on my thyroid. So it was totally unexpected. It was out of nowhere.
yeah,
And um, yeah, so I think I went 2 years without knowing what it was.
mm,
I didn't think anything of it at the time. That like they saw it and the doctor said, "Okay, we're gonna have to look into this now." And I remember thinking like, "What do you mean? Like, can't you just ignore it? Like, it's probably nothing.
right, right,
What do you mean?
yeah,
Like, why would it be anything?" Because I wasn't feeling any symptoms. There
yeah,
were
yeah,
no problems, but it was just a little bump on my
mm,
thyroid,
mm,
and so I went 2 years without like I think I did another check a year later, and then
mm,
another check 2 years later,
mm,
and it was slow growing. So, but they did find that it had grown.
mm,
So by the time 2 years had gone by, they're like, okay, this is starting to get to the point where this is not nothing anymore. Like the fact that it's grown to this size
mm,
is concerning. And then, so they actually, and you still couldn't see anything. You
right,
could maybe, like, I didn't know where to look, but
right.
some
You could
people could, doctors could feel
okay,
where it was. Um, and yeah, so it eventually got to the point where I did some more tests, and then each test kept coming back worse and worse. It was one of
mm,
those things like, okay, it's either A or it's either the good thing or a
right,
bunch of bad things.
right,
And then it was the bunch of bad things. And then they would go to that subset and be like, it's either the good one out of this set of bad things
okay,
or it's the really bad thing.
yeah,
And then it was the subset of bad things until they did a biopsy and then came back as cancer. So
okay.
um, I
And
had
so
surgery within 2 months, I think.
yeah.
They decided to remove the whole thing. The
Now,
surgeon
how did like
scared the crap out of me.
why remove the whole like was it absolutely necessary to remove the whole thing, or maybe I'm not so in tune with the thyroid gland, like could you keep part of it, or it was kind of an all or none thing?
That's like that's a big topic that
Okay.
there's debate on. But the reason my surgeon decided to go with removing the whole thing just because there's less risk of it coming back if you remove all
Okay.
the tissue.
Yeah.
Because if you have cancer
Yeah.
in the thyroid, there's something potentially that happened. I think like the thyroid's very sensitive to radiation,
Mm,
and if you were exposed to radiation in the environment or something like that, which I don't know why that would be for me because there
mm,
was no specific situation where I was exposed to radiation that I know
mm,
of. But yeah, uh if the thyroid's been exposed to something that caused a cancerous nodule,
yeah.
then it's possible that it could form again somewhere else,
Mm,
right? So I think his thinking was just take out the whole thing, and that way he basically said you should be good. Like you should be as soon as they took it out, he's like, you now should be able to live your life like anyone else, like
mm-hmm.
without worrying about anything coming back. So I still get checkups for it, but they don't they don't typically seem that concerned about it coming back, and so far everything's been normal.
So you just I imagine you have a regiment of medication that you have to take, or like is it
Yeah,
pretty
it's just one pill. It's just one pill I take in the morning every day,
okay. Okay.
and it basically just replaces the hormone. And I don't have to worry about it.
And have you noticed anything in terms of, I mean, it's such a long time ago now, but like just the quality of life now versus like before? Any changes that you noticed, I guess, with just not having a
Yeah.
thyroid?
Um, I think actually I'm feeling it a bit even now. I feel like my voice is getting a bit constrained. Sometimes I feel like um in my throat feels a bit different. Like it's
Okay.
not as easy to talk as it used to be.
Okay.
Sometimes like it'll get tired more easily
Yeah.
somehow.
Yeah.
Like it's not noticeable. It's not like a huge problem.
Hmm.
Um, but I can't like I notice just like a tightness in my throat,
Yeah.
and it sort of comes up more easily than it would have before. So it's
Okay.
it's like a minor issue, but it's sort of there all the time.
Yeah. Yeah.